Suite.
Hi, I'm Shelby. I'm the new dental nurse at Yorkshire Dental Suite, and I'm with Dr. Rajan this morning, and we have Rebecca Jones in for composite banding upper 6 to 6.
Hi guys, it's Dr. Sandy from Yorkshire Dental Suite. So we're just printing off some models that are basically study models, so we can use them to show our clients what kind of smiles we're wanting to achieve with an actual physical model. So we're just sending some models to the printer, which is behind us, and we'll show you the actual printer printing some models afterwards. So we're going to put it to work, and we're just designing more models for more of our clients. So just doing this before some of my morning patients, and yeah, really enjoying doing it. It's something that just speeds up our treatment, so we can do things faster as opposed to sending it out to a lab, waiting for a few weeks for it to come back and then get clients in. We can speed things up.
Hi, right guys, my name is Mohammed and I'm currently sorting out the Sweet Smile Store orders. We've got some water flossers here. Go grab yours on the Sweet Smile Store website.
Yeah, so just I saw this lady yesterday who was referred to me by one of her friends regarding rehabilitating her mouth. So I'm discussing this case with Dr. Nigel today, and the plan for this lady is to have extraction of all her failing teeth and possibly replacing them with the implant supported bridge for the top and the bottom. Patient was quite nervous, so the plan is to do this with sedation, and Dr. Nigel will be the main lead for doing this, so if you want to say something.
What I can see on this patient is we've got lots of bone loss around the remaining teeth, both upper and lower. Essentially we've got lots of available bone in the lower jaw to be able to place multiple implants to support fixed bridge work. In the upper jaw, a little bit more maybe of a concern. We've got bone in the front part of the mouth underneath the nose, but we've got very little bone. Patient's sinus drops really low on both the left and right sides. So we're short of bone really in the upper jaw. So with the bone that we have available, we could place implants, but we'd have to probably use something that clipped in and out using the available bone. Whereas if we carry out a graft in the sinus areas, we can provide or develop a lot more bone in this area and this area, which will allow us to place lots more implants to be able to give a fixed bridge top and bottom. So I think what you'd mentioned is definitely the case. Yeah. I think with K9 to K9 only, even with an all-on-4 type of arrangement, it's probably going to be better with removable.
Especially with the gum disease as well, I think.
And with this on the lower, we can get a fantastic distribution of implants on the lower, and I think we probably ought to match it with sinus lifts on both sides here.
Okay. Yeah,
certainly.
I think so. My contribution here in this case would be to give the IV sedation and also perform sinus lifts, so we can get good thickness of bone, so that Dr. Nigel can place the implant at the back to give you good distribution of the implant and support to the teeth. Yeah.
So we just seen the lady to discuss the options that we looked at in the X-ray earlier, and essentially the lady's decided to have fixed upper and fixed lower bridge work, which is implant supported bridge work. We're not going to be doing the sinus grafts because the lady wanted to have the treatment done over a shorter time scale and only one phase of treatment rather than it being split into 2 phases. So we're going to use slightly less implants in the upper jaw with a shortened arch bridge, probably got 10 teeth on it, and we're going to do a full arch lower bridge, probably with 12 teeth on. That means we've got the option later, if we want to put extra implants upper right and upper left and do sinus grafting later. But generally speaking, patients that have got slightly shortened bridges of 10 to 12 units manage perfectly well with them. So we're just arranging to see her shortly to take the impressions, get temporary bridges made, get CT scans done and get the planning side of it done, with a view to probably get the procedure done sometime in mid-July.
That's amazing. They don't feel like mine, but they are. They're perfect. Wow, they're much better than I thought. Oh my gosh, thank you so much.
You're so welcome.